I'm Dr. Elizabeth Hawkes and I'm a consultant ophthalmologist and oculoplastic surgeon. I specialise in upper and lower eyelid blepharoplasty and facial aesthetics for face, eye and neck rejuvenation. A bit about my background: I studied in London at Imperial College and spent time on my surgical elective at Harvard Medical School. I studied as an eye surgeon, performing surgery inside the eye, and took multiple fellowships in eyelid plastic surgery. I then combined the two to become a cosmetic eyelid plastic surgeon. My areas of expertise include upper and lower eyelid blepharoplasty surgery, and that's my most commonly performed operation. So upper blepharoplasty reduces excess folds of upper eyelid skin, and lower eyelid blepharoplasty reduces puffiness. What is blepharoplasty surgery? Blepharon is derived from the Greek term eyelid, and plasty means to mould, so you're essentially moulding eyelid skin. So upper eyelid blepharoplasty surgery addresses excess folds of upper eyelid skin. Frequently, patients will say they look tired when they don't feel it. Lower eyelid blepharoplasty addresses lower eyelid puffiness. So your eyeball is in a bony socket that's cushioned in fat. And what happens over time is the eye bags start to prolapse forward. And you have 3 fat pads in the lower eyelids, and that starts to cause lower eyelid puffiness. And the best approach is a lower eyelid blepharoplasty. Both these operations are surgical procedures, and it's day case surgery, meaning you'll come in for the morning or the afternoon and you'll go home that evening. The choice of anaesthetic varies between local anaesthetic, sedation, or fully asleep under general anaesthetic. This is guided by patient choice. My approach to blepharoplasty surgery is natural, and by that I mean I tailor each operation according to the patient's unique anatomy and requests. My surgery is safe. The goal of blepharoplasty surgery, performing it safely, is to protect the function of the eye. Eyelid skin is unique, as in between the eyelids you have an eye, and the ultimate goal of blepharoplasty surgery is to preserve function of the eyelids and maintain eyesight. So what are the risks of blepharoplasty surgery? Blepharoplasty surgery is safe surgery if performed in experienced hands. Combining my background as an eye surgeon and an eyelid plastic surgeon, I pride myself on safe blepharoplasty surgery. Of course, with any type of surgery to the face, there always carries a small risk of infection, bleeding, bruising, swelling, and a short period of downtime. On the whole, you'll have stitches in for the first 7 days after blepharoplasty surgery. They are removed by myself, and then we follow up again 6 weeks later. That first week after surgery, as you can imagine, you have the most bruising and swelling, but after the stitches come out, most patients are back to social activities at approximately 7 to 8 days after surgery. I always get asked, how much skin will you take away from my upper eyelid? How many millimeters will you remove? And my response is always the same. It's not what you take away, it's what you leave behind. It's really important that after performing an upper eyelid blepharoplasty, you are still able to close your eye and maintain function. So I always say I will take the maximum amount of skin possible in order for you to safely close your eye. So the eyes are the most central aesthetic feature of the face, and they're also the first part of the face that start to age. They're commonly associated with a tired appearance of the face, and this is for many reasons, but we're looking at ourselves more than ever. Video calls, Zoom conferencing, selfies, social media means attention's being drawn to our face, and particularly our eyes, more than ever, which is why rejuvenation has become so popular in men and women. And my approach to stay natural, and that way you can appear rested without looking like you've had work done, and that is very much the goal of all my patients. I have a range of concerns that present to me in a typical clinic. So they can be anything from low eyebrows, hooded eyes, dark circles, puffy under eyes, sunken looking eyes, fine lines around the face, poor skin quality, volume loss in the midface, volume loss around the neck, and I'm able to find a bespoke solution according to the specific requests. But overall, the common theme is patients start to feel they look more tired than they actually feel. Incorporated non-surgical facial aesthetics into my practice for face, eye and neck rejuvenation in order to enhance the results of surgical blepharoplasty. I incorporated facial aesthetics into my practice as I have 2 types of patients. Firstly, my surgical patients who, after performing blepharoplasty surgery, feel they look less tired and more rested, but then attention draws to other parts of the face. My approach is always natural, and I always offer natural non-surgical rejuvenation to the face, neck and eyes. These are a combination of skin boosters, dermal filler anti-wrinkle injections, and some energy-based devices. The goal is to naturally rejuvenate areas of lost volume and areas where skin quality could be improved. My second cohort of patients are patients that may seek eye rejuvenation but aren't quite ready for surgery yet. So for that reason, as a surgeon, you have to be able to offer non-surgical alternatives in order to rejuvenate the face and eye region. And this is a very common concern that I see in my practice.